Wellness is when the physical, mental, and spiritual states of a person are in harmony with each other and are perfectly balanced. It's an ongoing journey and one that, according to situation, will change and can change you. Immunity in children is a hot topic of discussion today. We have Dr. Renuka Anvekar, Director of Angam Ayurveda. She is a certified health and wellness coach practicing since 30 years in Ayurvedic Therapy Center with great success. Dr. Renuka is also a trained Montessorian. She is on the advisory board of several schools and has given several talks on social media on this topic, nutrition and parenting. Hello, Dr. Renuka. Welcome back to the show.
Namaste, Veena. Thank you and nice being with you too.
Thank you. The second wave of COVID-19 in India has left parents looking for information on protecting their children and the steps to take on building their immunity. The news of third wave is hitting us hard and causing anxiety among young parents. So we are glad to have professionals like you who are passing on right messages on how to keep ourselves safe, strong, and healthy during this time. So, Dr. Renuka, please tell us at what point of time do we start working towards the immunity of a child?
Yes. Yeah, as you said, Veena, it has been a really tough time. And luckily for us, the adults are being offered the vaccine. So I think 50% of the battle is won when all the adults get themselves vaccinated and, they are safe and they are not bringing it home to the children. So this is it. And as I always tell in my other talks also, I've been mentioning that this is a new disease. The doctors themselves are clueless about lots of stuff which is happening. They still are not having a proper treatment protocol too. So it makes right sense for us to really, when the government has told us that the third wave is going to hit the children, we have to take the best precautions that we can because they are the future of our country. And we definitely have to manage and see that they are not affected because long-term effects of this disease, nobody knows. So now I will be talking about immunity in the Ayurveda perspective.
Right.
So now in Ayurveda, we always know that we are all born with specific prakritis or specific constitutions. And these things have happened during the conception. So during conception itself, now if you want your child to have a proper immunity, we would start with something like Garbh Samskar, which goes much ahead. That is by the time when the parents plan the conception itself, we would actually think of having a healthy baby, engineering the baby in such a way that it's going to be having its full potential of health, body, mind, and soul. So we would advise parents who plan to conceive to undergo a body cleanse because both the parents have to be ready and at the optimum health levels also. And they can do the other things like food and other things where, the blood count and everything else is on the top optimum level for both the parents. And if the conception happens then at the right time, then there's every chance that the conceptus or the embryo is going to be, it's going to follow a fruitful outcome of a healthy baby. Now, during pregnancy too, in the Ayurvedic sense, we have got every month, we have got a separate kind of diet which the mother has to follow, which is going to again optimize the growth of the body, somatic and psychological also. We believe that the emotional intelligence and everything, the IQ, the brain growth, you can optimize. So you have just 9 months in utero and it's limited. But once the baby is out, you have a small window of around 0 to 6 where you can optimize the brain growth. The body is going to grow irrespective of whether you are going to feed it, because the child is going to cry for when it is hungry. When it's uncomfortable, it's going to give you an indication. But the brain growth, we don't know much. So you have to optimize both the brain, and very lucky for us that when you target the brain growth, even the body is going to grow. That is the beauty of the brain, the growing brain in a child. So in Ayurveda, immunity, when we talk, we have two kinds of immunity. One is an innate immunity in the child, where the disease is not going to attack the child at all. Second type of immunity is if the child gets infected, he is going to recover it from it very fast.
Right.
So we call it Vyadik Shamatva. That is, immunity towards disease is two types. One is innate, and one is when they get it also, they have to recover without any prolonged side effects of the disease. They should not be suffering from it. So coming to that issue, the most important thing for innate is, one is the constitution I told you. Then the other thing is the immunization schedule that we generally follow. We have a long list, we have a polio vaccine, varicella, you got a DPTs and you got a BCGs. Those are the things protocol wise, and they have helped the world at large. So it is all recorded and it is documented that it is going to help a child. You can prevent all those diseases in a growing child, and it has helped India a lot also. So it's a very small group that says that you should not immunize your children and all that. But I'm talking this as a personal experience, that you have to do all those immunizations which a child needs to do. That's how we induce immunity in a child. That happens as an external thing where you're putting an inoculum or a attenuated virus or whatever it is, and that is scientifically proven, and you're going to go up. Second thing that we can do is food. That is the greatest thing that you can do. And for that, 0 to 6 months is total breastfeeding.
Okay.
I wouldn't even hear of anyone who's going to skip that. But there are some cases, medically unfit or something which has happened, that the breastfeeding is not being done for the baby. There'll be plenty of reasons for that. So there you have the feeds which the doctors themselves will suggest. Those are done as close to the breast milk as possible.
Okay.
So you don't have to feel guilty. That guilt thing you can take out from them. The mothers can take out from their minds. This is the closest you can get. Otherwise, what else is the baby going to have? So you need to have up to 6 months, and then you have a regular manner to wean off the child. Now I'm talking about the Indian context of weaning off.
Mm-hmm.
We do have our own cultural foods, finger foods, which we can give, and the cultural foods that we have. Very slowly we start weaning off the child, and by the child is 1 year, he should be sitting at the table and eating whatever the rest of us are eating.
Right.
So I wouldn't say anything that and I can tell you the things the child should not be fed.
Okay. Yeah, I was about to ask you,
Initially,
what kind of foods do you suggest?
not fed.
Yeah.
Yes. Okay. So the first thing is, butter is very, very good for the child's growing brain.
Mm-hmm.
So up to age 1, I would suggest that the mother adds a little bit of this yellow butter, not the white one,
Okay.
The carotenes and all have to be there, a good cow's milk. And generally they say we do the butter at home and then we make the ghee. But there is a very important link there where the mothers, they collect the cream. This happens in every household. They collect the cream of the milk. They store it in the refrigerator, convert it to butter, and then they make the ghee. But in this, what we have noticed is that the one they convert it directly into butter and then they make it into ghee. There we see that the cholesterol increases when you have that kind of ghee. Mm-hmm. So there is a crucial step of converting that butter into curd. If you do not convert it into curd and then make a direct butter and do it, then it's a problem. So we insist that you convert that cream into curd, then you cream it out and take out the butter, and then you make the ghee. Wow. That time household butter is very good. And for little children, we would prefer cow's ghee.
Okay.
Not buffalo. Buffalo ghee it is tamasic, what we call. It makes the child sleepy, and it's buffalo is generally associated with a low level of intelligence and activity, and that's what we don't want our children to be. We'd rather want it to be a cow which is grazing in a pasture. Right. So that is one of the things. And ghee is the best food for the brain growth also. So as a precursor, we need a little bit earlier. So we started with the butter, and then we go on to the ghee. You add everything that you're going to eat at home in a graded manner, of course. If you all are eating a too spicy food, then you'll have to definitely stagger it, for the thing, for the tongue of the child. Mm-hmm. And salt. You can start not totally withholding the salt and giving bland food, but just enough salt. No salt added at the table.
Okay.
No fried stuff like potato chips and all that, especially for male babies, because the tongue, they get addicted to salt, taste of salt. It's an addiction. Okay. Salt is an addiction. Yes. If the family has a history of, genetic history of having hypertension or diabetes, I would advise the parents to start holding the salt and all that in the childhood itself. Okay. So it is a research fact that if you can really, one generation skips that disease, then you can route out that disease from your whole genetic pattern itself. So there is a beauty there. So just one link, if you skip it, then you can take it off from your thing. So you can understand how important a mother's role is, because mothers, why am I saying mother? Because the mother is the closest, and definitely do not encourage the fathers bringing the chips in. And not even feeding the children a little bit. So, I mean, as a mother, you can be very strict about it and say that, no, it's not going to happen. And we are not going to feed the child this thing. And other things is how the family, it happens in the family. Yes. These are the things you really have to take a look at. And once this innate immunity is set in a child, then definitely, even if the child is affected, then the second part, what I told, if the diseases occurs also, there's easy way of recovering. Yeah. So that can happen automatically. And one more thing is we should take this one, that we will not expose the child at all to such an environment, especially today. Otherwise, they used to have chicken pox parties where when the vaccine was not yet given, supposing a child has chicken pox, all the children in that area would go to that child's house and play around with that child so that they too get it. And it is a lifelong immunity. So they used to call them chicken pox parties. Okay. That doesn't happen nowadays because we have a varicella injection. We can give them just like an immunization schedule. It is an inbuilt thing where you can have one for chicken pox also. You need not get the disease and derive an immunization. You get it right now. Right. I mean, you get the immunity, so you are not going to get it. Even if you get the disease, it's going to be very light. Here and there, two small pustules will occur and it will go. So that's the way you have to handle it.
Immunity, you mean to say?
Absolutely. It does give lifelong immunity. Yeah. In case the child does develop any disease or in the third wave, whatever, please make a note that the child needs to be given food which is very easily digested. It could be just plain soft rice, very softly cooked. Anything that is cooked in water, the child is going to make a fuss to eat. So please do not give it pizza or any junk food or anything that is going to make it very difficult for digestion. And I'd request you people not to have any fermented foods like dosas and idlis. You can just make plain rice something, which you can make. And no fried rice and fermented foods and junk foods, please. You can just have plain rice, sambar, and we have so many other things that we can give. Poha is there, rice, just curd rice or something porridge. Like that. Very simply, yeah. Nothing porridge, yes. And we would say this pongal, what we call, this khichdi. That would be a very good kind of thing. In that you can even add a little bit of ghee, but never oily stuff. No pakoras, those kind of things. As long as the fever and other thing is there, you have to give it food which is very easy to digest.
Right.
So this is taken care of. And I just want to add to the parents that in Ayurveda, we have something called Suvarna Bindu Prashana. We, every month, on the Pushya Nakshatra day, we administer gold bhasma drops in ghee, which is definitely going to help the child's immunity to be on top form.
Okay.
So what we are suggesting now is every day, you can give one of those drops, go to the nearest Ayurvedic doctor near your place and just get it for the whole month. It doesn't mean when we are in a regular setup, we generally have it only on once a month on a particular nakshatra or a star, we call Pushya Nakshatra. We introduce those drops only that time. But right now, you all can give it every day for 21 days, take a gap of 9 days, again repeat it. There's nothing wrong, and it is going to keep the child's immunity on top form. You can do this in advance, and you can start giving the good food to the child. That's what we can. I would like to tell the parents.
Thank you, Dr. Renuka, for the profound knowledge you have shared with all of us. We will catch up with you soon on more informative sessions.